Today we're going to talk about smile design, and designing a smile, I think, is what separates a good artistic dentist from a great artistic dentist. And I think too many dentists totally ignore the smile design process. They take impressions, they send to the laboratory, whatever the laboratory decides to fabricate as part of the smile design, they put it in and they hope the patient is happy. And you know, Denise is our patient today, and Denise's goal is to have prepless or very minimal prep veneers. And I think in the concept of minimal or non-prep veneers, I think too many dentists think of that as almost like a cheap veneer or a lesser veneer, and I think that's a huge mistake. And I think a lot of dentists, when they're doing these non-prep veneers or minimal prep veneers, again, just take impressions, send to the laboratory, and have the laboratory or the ceramist decide what the smile is going to look like. I think it's important to make sure that we are part of this design process, even with prepless veneers, so that we can get a result that will rival what we will typically get, or at least come close to what we'll typically get with a prep veneer. All right, as I mentioned, if we know where the facial surfaces are going to be of the centrals, the lab can then ideally design the laterals and the canines. But it's the buccal quarter that often is insufficient and will give that clap smile look. And one of Denise's goal was, as we talked earlier, was she wanted a broader smile. And so her premolars are actually set back. And I can just show a photo to the ceramist and say, bring out the buccal quarter, but what does that really mean? A millimeter, an inch, a half millimeter? So we're going to actually try to duplicate that ideally in the mouth. And again, it doesn't have to be perfectly smooth or ideal, it's just a dimension. And then the ceramist can match that. So obviously we need to bring out the canine, but we're going to go ahead and do it premolar first. Again, a bulk of resin. And this is very, very common in these post-ortho cases. Go ahead and cure that, please, Daniel.